if you were advising a pre-med student, as far as, you made a couple comments on job shadowing hours, but the importance of experiences that are not necessarily what you're seeing every day in Main Street America. I know you find that helpful as a person and ultimately as a doctor. Was it helpful from the med school process?
Yeah, I think so. Actually, so after I went to Peru, I kind of ended up taking a bit of a circuitous path to medical school, even though I always knew I wanted to do med school. I ended up getting this fellowship when I graduated from undergrad, where I spent 8 months abroad. And then between kind of my experience in Peru and my fellowship abroad, I ultimately realized like that health is not just medicine. It is
Yeah.
culture, it is environment, it is all of these things, right? Like, for example, political climate and structure, right? Like Peru is a Catholic country, like that affects healthcare and that affects like
Yeah.
women's access to health. And the same can be said in the US for a number of things, but it is kind of different when you see it through like another country's lens. And so between kind of my experiences in Peru and then my experiences like abroad, I was like, going to medical school and getting an MD just didn't feel quite like enough to me. And so that's really why I ended up doing this like integrated 4-year MD MPH program. And I think, I wanted to be a great doctor, but I also felt like being a great doctor, like I needed to have like this broader perspective of like what shapes someone's health. And how can I change like systemic things to help people have better health outcomes.